So good morning, everybody. Here we are. It's only 38 below outside. Warming up just a little bit to 32 this afternoon. I want to say welcome to Paul Heinrich, a regular, it seems, Paul, every year with Women to the Power 10 Living Fit. And we really appreciate that, by the way. He is president and chief executive officer for the North Bay Regional Health Center. And Tammy Morrison is on board as well, and she's president and CEO of the Regional Hospital Foundation. So welcome, Tammy. If you want to do a PowerPoint first, and then Paul will come on after you.
Perfect. Can you see my PowerPoint screen here?
Yes, we can. Thank you.
So thank you so much for having us. And I'm going to give a little bit of an update. But first of all, I just want to extend our thanks and gratitude for all the support that you and your one second.
Okay.
That you and your colleagues have supported our health center in so many different ways over the years. Certainly you've supported in the construction of the new health center, our surgical program, pediatrics, and of course the Seeing More Clearly campaign that purchased our community's very first MRI machine. And so just want to extend our thanks and gratitude. Paul's going to give a little bit of an update on the hospital, and then I'll continue on with some of our foundation.
Okay, perfect.
Paul?
That was it?
No. I got more to come, but you get to go first.
Oh, you're going first. Okay.
Oh, okay, I get it now. I was waiting for you to finish. Okay, I just have some opening remarks, and then it might spark me to go a little deeper here, but here's what I just wrote down just for this morning. And so COVID-19 has left this hospital and all hospitals feeling challenged in numerous ways. Ensuring a safe environment for our staff and patients meant quickly moving to change hospital operations. Some of the changes we made were obvious to the public, like staff and public screeners at entrances and additional personal protective equipment. Other changes are not so visible, like how our health center took in transfers of COVID positive patients, critical care patients actually, from the GTA, from Manitoba, from Saskatchewan, to help and in our own Northeast region to help increase capacity for other overwhelmed hospitals. We fully complied with the Ministry of Health mandates. The most recent one that you're probably aware of is the pause to non-urgent surgery. But while adhering to the mandates, we safely provide all cancer surgeries and diagnostics for our patients, and we've never delayed or canceled any cancer surgery at any point in the pandemic. We've been running a COVID assessment center for nearly 2 years, and we support our care partner. Those are the people that come in to support patients that are their loved ones, but also their care partners. We've supported safe access to our facility so they can provide much needed support for their loved ones during the hospital stay. And I can tell you that we have the most progressive leading practice care partner access policy anywhere in the province. These changes alone would leave any sector feeling stretched, but hospitals have been dealing with these challenges on top of historical pressures facing healthcare, leaving us operating most days at 110% capacity, despite being ramped down on surgeries. The transmissibility of Omicron has meant that on any given day, we could have 5 to 10% of our staff unavailable to work because of sickness or isolation requirements. And we felt that when we had 180 people off all at the same time. And we were one of the first hospitals to experience that. Everyone has come together to support the hospital, including people like yourselves in our community is so supportive. We've demonstrated adaptability over the last 2 years. Our community, by following health guidelines and stepping up to be vaccinated, our primary care physicians through their hospital duties, seeing patients in their practices and supporting vaccine clinics, and our hospital staff going above and beyond for our patients and also helping to reduce the risk of transmission and keep our hospital safe. As we're looking forward to returning to normal, probably 4 to 6 weeks after the rest of everyone feels normal, we may have a chance to feel normal. And yeah, so it's been a slog, and I think for all of us, we didn't expect that it would go on this long, and nobody really got a break for the last 2 years anywhere in the organization, including this past holiday season when, you know, everyone had been looking forward to that for a very long time. But despite it all, we have the best hospital anywhere in the province, I have to say. I have to knock on wood, and I'm not allowed to say this in front of my staff, but we have not had a COVID-19 outbreak in the hospital. And you know how, now I'm not saying that won't happen, because COVID-19 outbreaks are going to be kind of routine maybe in the near future. We have to find ways of proceeding, you know, with a different set of rules. For example, being able to admit into long-term care even during outbreaks. Now, remember, the thresholds for outbreaks are very low numbers now, and it's you know, virtually endemic issue now. So it's going to change the landscape. But up until now, it's really literally amazing, and it speaks to how good our infection prevention and control practices are. You know, and by extension, our infection control, I want to point out as well that we have some of the best infection rates post-surgery anywhere in the province. So literally, it's a little engine that could, a lot of big hearts and amazing team members at this organization, and incredibly proud of everything they've achieved. Yeah, before and after or during the pandemic. So it's pretty special. I feel pretty honored to be a steward for this organization in this community right now. Anyway, I'm yammering on, so we can get to any kind of questions anytime you like.
I think that's a good time to for us to address some questions, Paul. But I just want to take a moment and say our deep gratitude to all of your staff. And we have no idea what you're going through over there, really. I mean, we can't be in your shoes, but I think that we all support everything that you're doing to keep our community well. And so I have a question I wanted to ask about morale.
Yeah.
You know, have you got a policy in place to, because I'm thinking if I were any health professional, it must be so taxing to see no light at the end of the tunnel right now. So can you just elaborate on that a bit?
Well, personally, I don't think you can mandate positive morale. And frankly, as a leader right now, I'm one of the most optimistic people you'll find. And frankly, as one of the things is I end up being optimistic a week ahead of everyone else because I find things out a little bit early. But for that week, I got to pretend that I'm not happy. No, just I guess you have to be alongside the team. There's no denying that the pressure is redonkulous right now, and all you can do is be empathetic. Having said that, we just first of all, and we do one of the things we do differently from most places is that we organize treats. pandemic snacks, they're called too. That's one of the things that we try to use. We have excellent communication, so everyone knows exactly what's going on, and it helps us avoid conflict situations. But you kind of do, there are tensions and emotions, and all I can say is that it's worse everywhere else, because we have the kindest hearts, and the most caring people, and we're thoughtful about it. And I will say though that there is such a thing as we do a staff, what's it called? Anyway, it's a survey of staff, basically to measure their morale and how they're feeling. And we typically do this at like the worst possible times, because you have to kind of do it every couple of years. I think we did it after we had to terminate 400 full-time equivalent staff in 2013, 14. And we didn't get like rave reviews. Like every time we've done it, and this one we did maybe measured 4 months ago, I was really pleasantly surprised. Certainly people were reporting that there was a heavy workload. The one thing, but it was generally positive and better than previous surveys, which really blew me away. The one thing that they stuck out for me that they complained about, the 700 people that replied, we didn't get a good mark on, I have control over how my job is done. And I'm thinking, well, no doubt, because we said, do this, now don't do this, do that, do it this way, change it to that way. Because the guidelines changed. This isn't us doing that. That's just ministry and medical officer of health guidelines coming at us left and right a couple times a day at some points. So it's no wonder that people don't feel like they have influence on how their job is done. And that's something that we have been driving towards, including our staff and training them, and involving them in decision making, and quality improvement has always been a hallmark for us. And we just couldn't do that in the circumstance of the last 2 years. So anyway, when all else fails, we give snacks out.
I just want to build on Paul's
Oh.
comment around the snacks, actually, is that, throughout this pandemic, our community has been so incredibly generous, and we've had, people in our community wanting to support local businesses and local restaurants, purchasing food and nourishment for the staff at the hospital, and then delivering it, and just to lift the staff spirits. And so many of those acts of kindness over the course of the last 2 years have really helped, pay that tribute to our frontline workers, and to, help their morale during these really tough times. And I'm so pleased we have another community partner next week who will be doing a little delivery that I know that a few of our units are really going to appreciate. And, so along with the hospital providing the COVID snacks or the pandemic snacks, we've also got amazing community partners contributing in as well.
Jill?
Yes.
Thanks, Tammy.
Thanks, Harry. I just have a few comments, and these really are directed at Paul. I am impressed with the how all of you at the hospital have coped with the tremendous stress of COVID. I am a retired nurse, so I have some inkling of what goes on in a hospital. I've been a caregiver. I've also been able to, through this period of time, have access to certain tests that I needed. I also, for 3 weeks, had an opportunity to volunteer again at the hospital just before Christmas, and that was in the role of an ambassador at the main door. And I do want to make a comment about the team that you have on the main door that screens us all, has the patience of Job, always have a smile, always pleasant, always kind of keep order in that front lobby as best they can, always with a smile on their face. And I just want to say, I think you guys are doing a tremendous job there. That's it.
Well, thank you. I'll definitely pass that on. I echo your sentiments. The level of professionalism and adaptability it's sort of shocking to me, and it's this whole experience has made every one of our team members better. You know, even personally, I always thought I was a pretty good guy, but I've actually become, you know, more selfless, more thoughtful about other
Yeah.
people. You know, it's actually improved my emotional intelligence. You know, and you know, as much as it's been very unpleasant at times. It, you know, it has done something positive. I would just say that it's, like I said, it seems to have made every one of our team members better too, and more thoughtful. So
We have thank you very much, Paul. We have Mary Lee and then Heather.
Yes, mine's just a comment to Paul and Tammy. We had a friend from down south that had a hip operation in October. She'd been waiting for a couple of years down south and found out she could get in here. And she had nothing but praise for the hospital. She said, "You people are so fortunate to have such a great hospital." She was in about 4 or 5 different departments, and she said everyone was so caring and helpful. And she just felt that it was a great, great asset to our city. So thank you very much.
Nice, nice.
that's so nice.
Thank you, Mary Lee. Heather, unmute, please.
I just wanted to say, Paul, congratulate you and your comment about the infection. I moved here from Sudbury 4.5 years ago, and the infection rate there was so high that when people were given a choice whether they had to go to the hospital or not, they didn't. And everybody was bending over backwards not to have to go to the hospital. It almost was like, most of us thought it was like 100%. So the fact that you're the best in the province is so rewarding and so good for the citizens of North Bay. And thank you for that, and your staff.
Thanks. I would just make one other comment just in terms of surgical site infection rates. We actually have, like I said, we've been really focused always on continuous quality improvement. And we recognize, I'm going to say maybe 5-6 years ago, that our infection rate was in fact worse than average, I would say, in terms of the rate. And so we joined a National Surgical Institute of Quality, I forget what it's called. Dr. Singh, who was our chief of surgery at the time, was really leaderful in that respect. We assembled a team. We implemented all the best practices from this NESQIP. And now we have, as I was saying, like even better infection control for post-surgery. And one of the best rates anywhere. So that is just very comforting. And it takes a lot of, like when everyone's busy doing their regular work, and to have them continuously improve the work that they do in a systemic way, it's almost become inherent because we practice so much. But to continuously improve the work that we do. And I'm so proud of that. I'm so proud that we didn't cancel any cancer surgeries ever. We're not even behind in any surgeries. As much as we're on pause right now, we'll be fully caught up for the residents locally within a matter of a few weeks to a month. So access and I actually saw my family doctor today, and I got referred to an ultrasound for this morning. I saw my family doctor yesterday. Now, I don't know if everyone gets that kind of turnaround.
Wow. We hope you're okay.
No, I'm fine. I'm fine.
Oh, that's good. Bonnie Bolger, go ahead, Bonnie.
First of all, I want to congratulate you too. I mean, the hospital has been very efficient. My granddaughter's been up there twice in the last couple of weeks, once through the COVID unit and once through the emergent. Everything went really well. Now, my question is, and it's not a judgment at all. I just would like some information behind why you didn't put in the vaccine mandates when other hospitals did. Was it a staffing issue? Yeah.
Great question. So first of all, and now I think the rate, I'm going to tell you that what other hospitals did, it was half and half provincially. So the northern hospitals, many of them moved more quickly than we did in terms of making it absolutely requirement to be vaccinated. And that was definitely, we didn't want to move too quickly on that because it's a dangerous ground. And we wanted to make sure that we were being as thoughtful and giving as much opportunity to our staff to make a decision as possible. That's number one. Number two, I was definitely very nervous about staffing impacts that we're now feeling. And I didn't have the benefit of foresight to know that even at 10%, we could move our people around and manage if we had 10% off, because what we've been doing and not dropping the ball anywhere. But before that, and the number could have been much worse in terms of the number of people off at the same time. I was definitely worried about that as well as, so, and I was also appointed as the chair of Health Human Resource, Ontario Health North, HHR Task Force Chair. So I was even more acutely aware than others. But again, it was half and half hospitals in the province. We reached out to many other, we've been comparing notes forever. And then, and one of the drivers for eventually getting it done was also that it was a heavy burden administratively. And as you know, testing resources have become scarce. And actually the number of tests and the extra bureaucracy of the work we do to test these people every couple times a week was becoming overwhelming. And anyway, it's a divisive issue. I think we waited a proper amount of time. We had some extra steps in there to make sure that our mandate didn't disproportionately impact from an equity, diversity, and inclusion perspective, any groups. And one of the flags that we had as well was that there are, a higher proportion of vaccine hesitant people in marginalized groups. So the extra time we took allowed us to try everything possible to be as thoughtful to those frontline workers as possible. And ultimately, at the end of the day, I think 11 plus 17, about 28 people in total no longer work for us, which is a pretty small number, relatively speaking, based on 2,300 staff. And our process allowed our rate of people terminated as a result of that mandate to be quite low percentage-wise. And I would just say as well, the moral distress that weighs upon people like myself in making such decisions that will ultimately severely negatively impact our staff and their well-being. And I got to balance that out with the most important thing, which is patient and family quality and access.
Thank you, Paul. Any other questions? I have one for you, Paul. I see that COVID, I always call it a gift to COVID, is that we're moving from I to we, and what community really means. And so I guess I'm curious, I don't know if you can answer this question, why someone would risk their career and not get vaccinated. I'm just curious about that.
There are some people that are convinced that that they're going to win some future court battle, that we're going to be ordered to take our staff back. And truth be told, Mr. Ford pondered that. In fact, we know that independent sort of anti-vaccine, anti-masker politician did write an open letter to hospital CEOs, basically making the point then that you should immediately bring back all the people you terminated because of the health human resource crisis. And we were pretty worried that that was going to be reversed. And so, yeah, I think it's a mistaken belief that power of the universe will somehow reward them for the injustice that's been done to them. But I mean, they're really not thinking about others when they should be.
Thank you. Any other questions?
Harriet, I think there's one thing I feel like I should just describe a little bit, and not to lay it on too thick, but I just want to talk about our overall capacity issues a little bit. And then I see Bonnie has a question,
Yeah.
but I just wanted you to give you a context here. So 2 years ago, when pressure started, well, let's just start before that. We were packed in our hospital even before the pandemic. And we had lost the capacity in Trout Creek for long-term care. And as a result of the pandemic changes, it'll never be possible, I don't think, for a resident to go into a ward room. They'll never be more than semi-private in terms of how they did that. And in Nipissing, when they made that new rule, it immediately meant 70 less long-term care beds available to our district on top of the 60 beds that we lost in Trout Creek just a few years before. So when Trout Creek was lost, we added a 20-bed transition unit. And when COVID started, we added 35 additional beds to our hospital. And by the way, we don't have, so that means some of those beds are in non-conventional spaces like the sunrooms, etc. So we were busy before, and then we had to basically take even more into our hospital based on this loss of long-term care capacity. And so even though we're shut down from surgery, which is intended to allow us to move those staff around and fill the gaps, it's gotten worse. And patient flow is an issue. There's staffing issues in home and community care, in long-term care. And so they've been, unable to help us as much as they should. So we just got busier and busier. And just this last week, we added another 10. So I mean, we've added, 45 additional beds from 2 years ago, and they're all full, plus 10% more than that. Just creates enormous pressure on our emerge and other parts of our system in the hospital. So we're working really hard with our community partners, and we're trying very hard to help them help us by getting patients into the right place of care. And so there's hope on the horizon, but I just wanted to give you a sense of just how much pressure is existing today. And we don't see there's a lag time after the restrictions are going to be lifted and everyone's going to be happy. And the hospital for 4 to 6 weeks is going to be trying to battle this beast of over occupancy to the ground.
Bonnie? Thank you, Paul.
Well, it's kind of funny because that was exactly my question. I'm just wondering, because of this pandemic and the issue of backlog in the hospital, is the government really looking at a better flow rate out to the nursing homes? Just in terms of if the whole building is shut down, is there units that don't have any COVID or infections on it? Why can they not still be moved into, say, Castle Home, which is compartmentalized and that sort of thing? I know it's a government regulation at this time.
Rewind. I could just play that at a meeting coming up with our partners. You just said it perfectly, Bonnie.
Well, especially with our advanced infection controls everywhere. I've been a part of Castle Home because of my mother, and certainly need empty beds, but they have been really good to maintain their PPE, their infection rate, that sort of thing. So I don't really see the huge problem. Is the government just lagging behind that?
So you've asked a really, really good question. I'm going to give you a straightforward answer and try not to offend any of our, anyway, because I don't think it's anyone's individual issue. But so the first thing, something kind of exciting, and just started here. is that did speak with the administrator of Castleholm, who had indicated that they'd be happy to take some more patients. I will say that there's been 20 or more available beds at Castleholm. I'm talking available, not offline, for the last 2 years. And the flow there, that's literally the only problem that we have in terms of flow to long-term care. You know, I think it's partly because it's an old building or whatever, but there are literally 23 available beds today. And yeah, we have people overflowing in the hospital in every manner. So it's frankly something that I think about every day, that I challenge leadership above me in terms of the ministry in Ontario Health. But anyway, so the latest thing was, and I started to recognize, well, this is ridiculous now. They're going to be calling an outbreak, even for vaccinated people. Like, there's going to be 2 to 5 people that perpetually now, it's a different construct now. There is going to be outbreaks almost all the time. And we can't let that stop people getting into the right level of care. We can do that safely. And so I had this conversation with the administrator, who said he'd be willing to do that, to get a bunch of patients over there. But that he was concerned that the public health unit wouldn't support that because of the outbreak situation. So then I phoned Dr. Chirko and I said, you know, this is a pretty urgent situation for us. What do you think? And so thrilled that he was highly supportive of making that happen, despite them being in an outbreak. And so actually that little series of events happened a couple of weeks ago. And so like from there it spread, because these emergency response teams, I'm actually the official emergency response lead for Ontario Health for the district of Nipissing. And so I sit on the regional table, and sometimes, and I certainly have some influence, sometimes provincially, but you know, everyone's asking for things, so take it with a grain of salt. But what I said was, you know, you've got to make this a standard. Like, we actually have to have public health across the province proactively building guidance and actually facilitating that movement to reassure staff and residents of long-term care home that what we're doing is safe. But it's now in play. And like I said, it was flagged here, and I'm just waiting for some guidelines. And I did even reach out to our MPP and indicated this same challenge and explained it to him. And he committed to bring it up at the very next cabinet meeting, which I'm sure has already happened. One of the other strange policy things that happened, and it happened earlier in the pandemic, and it just happened again inexplicably, is that long-term care homes are funded at 100% occupancy. So even if they're only at 90%, you know, it's just a weird disincentive to not take patients on top of the anxiety over infection, which you should be becoming less concerned about in the long-term care homes. So there's a lot of activity in that front. So now that we have the full support of public health locally, but it's now translated to public health. And I wanted to say all public health medical officers of health communicate with them in an extraordinary way now as a result of the pandemic. So as soon as we had this thing play out in North Bay, Dr. Chirko was on the phone with his medical officer counterparts. And now, you know, within days, it was a major agenda item for their work. So I'm actually really hopeful that some more explicit guidelines that will encourage the transfer of more patients is on the horizon. And maybe we wouldn't have been able to have that system improvement if we didn't have a crisis. And I do like to say that should never waste a crisis. And hopefully we'll have made permanent change in the mindset and thinking about patient flow. And we're now even understanding what the underlying root cause things are. And it's almost exclusively inequity and rates of pay amongst staff in different parts of the system. And I don't really want to say anything political, but You know, there's private operators as well, both in home and community care and in long-term care. And when your goal is profit, you're going to pay your staff as little as possible. And then, which I guess works okay when the pressure's not on, but when everyone's getting burnt out and moving around jobs, you know, the real issues get exposed in a really direct way. And again, I just hope we don't lose this opportunity as a society to make some fundamental change in how the system operates, because it's just frustrating trying to convince people to take patients every day and having more just arrive at the door of the hospital. Sorry for that long soapboxy tirade.
Thanks so much, Paul. Thanks for the question, Bonnie. Okay, we have a question in chat here. Wait times in Emerge, how do they compare to other Ontario hospitals?
The wait times are bad everywhere. And I would say we're better than most. We do monitor that. So, you know, our rates are definitely, I would say, at the average or slightly better than average in terms of wait times. But as I've described to you, our Emerge is under tremendous pressure. The other thing we're doing is our assessment center is now really about assessing, and people with moderate COVID symptoms that may not be able to cope, we're going to be directing them to the assessment center so they don't end up in Emerge, adding more pressure to our Emerge team. We have had some staffing challenges as a result of sickness, et cetera. And we've rounded up some other docs that are going to help us, some from Ghosts of Christmas Past and a few new people. And we're asking specialists to also help out and Emerge a little more than they normally do. So we're managing that and our wait times are pretty good. But like I said, this is they're getting worse. And that's a byproduct of us not being able to move patients to long-term care and home and community care.
Thanks, Paul. Bonnie raised her hand again. Okay, go ahead, Bonnie.
Have you ever looked at a two-tiered system in Emerge where you have maybe a nurse practitioner dealing with like ear infections and things like that? And I know they can't bill the Ministry of Health, but is there not some way under the hospital's cover, or is it the doctors that don't want that? You know,
No.
especially for simple things.
We are doing that. I have to ask our Emerge chief to more perfect answer on this, but we are doing that, and we just don't do it every day. And I think that's and also we don't want to encourage people coming to us for things that should be managed in the community. Number one, so in a way, it's sort of, you almost like encourage the wrong behavior by doing that, but we absolutely do that. We do have a fast track section, and I wanted to say something else about that, but I know, I just wanted to say I'm just so impressed by our primary care docs and other, even MP clinic, in that they're, in the first wave, everyone turtled, and it was like, oh, no one can take anything because it's too scary. So everyone came to the hospital. This time around, I'm just so impressed by especially our primary care docs, because we have the way we deal with our inpatient beds, it really relies on general practitioners supporting the in-hospital part. We're pretty unique in the degree in which our primary care docs work in the hospital. On top of that, over 50 of them have supported vaccine rollouts, the assessment center, and now they're in person and open, and they're doing it. And I just can't get over how responsive primary care has been. And I would be apt to criticize it on a global level, maybe a couple of years ago, like, do more and be more available. But I sure can't say that now, because they've just come to the plate in just incredible ways to make sure those patients don't end up in Emerge and putting that pressure on and destroying our wait times.
Thanks, Paul. I have one last question for you, Tammy. We're going to get started shortly. My question is, our Women 10 Living Fit, our theme for winter is empowerment. And what can we do to make your job easier? What do you need from us?
I think it would be, it's a good question. I think awareness of what is the right place to go, like I've just described, the COVID assessment center in its new form, and we're trying to get the word out about that because, you know, it's fairly new what it's been asked to do. And, you know, that's one way that we're diverting, just encouraging people just to have the right information. Even though you hear we're not doing non-urgent surgeries, we want people to be thoughtful about how they access resources, but also we don't want people to feel like they're imposing on us or that they're, we don't want people sitting on some sort of problem that they're experiencing that could actually be much worse than they think it is. We don't want that to get worse. That's how you can help us. We don't want you to get sick or anyone. So like get that assessment and don't feel bad about going to your primary care doctor and booking an appointment. Like get the assessment. Don't try to make that judgment yourself. Help us spread the word about how you, what the right place to go is. And as much as possible, primary care, and they are open, like I said, and just don't assume that they're not going to answer the phone, which, you know, I think some of us anyway, may be jaded from the past, but, you know, it's working out there. I think that's the best way you can help us. Jill, I think we're going to be bringing volunteers back pretty soon, actually. Kim McElroy is talking about that. Those of you who do volunteer for us, we'd like you back again. And I don't know, I just think it's spread the goodwill, and you know, we do a lot of things right, so we mostly get compliments, but a small number of complaints has a a disproportionately high impact of negativity. So, you know, I think often it's a lack of understanding about what's happening at the hospital that leads to you know, frustration about what we are or aren't doing. So I think it's just continuing to be our cheerleaders, if you will, which people around this table, they're very comforting. Actually, I remember when I first came, you would get really, really tough questions that you're trying to throw me off. And so now, like every time I come here, I really look forward to it because I feel supported. So just keep doing that for us.
Well, I think you can count on our support, Paul, that's for sure. And there'll always be the tough questions, but it's just out of an interest and a curiosity. I think that what you coming to our sessions once a year is really invaluable to us. We get a up close and personal look at what's really happening. As you say, the news headlines sometimes can be misleading for sure. So thank you. Okay. And one empowering thing we could do, and you didn't mention it, but I know Tammy is, and I think I like to buy those lottery tickets once a month because I feel like I'm supporting local. So go ahead, Tammy.
You absolutely are supporting local, and thank you for playing. And I always wish everybody the best of luck. So thanks, Harriet, for that little plug. So, you know, it's such a privilege for us to, oh, hang on. There we go. It's such a privilege for us to do the work that we do at the foundation. And, you know, the purchase of medical equipment is a partnership between our hospital and our community. And so in order for us to provide the best possible care close to home, community support is absolutely essential. And so I did mention collectively that you've supported our hospital, but I also want to acknowledge that I see so many familiar faces of our donors in front of me right now. And thank you for all of your own personal donations as well. And thank you for all your personal purchases of our lottery ticket, both the 50/50 and our annual lottery. Those are just a fun way to have a game of chance and to also support a local cause. So thank you so much. I'm really also very excited to tell you about this program that we have become a part of. And it's a national campaign called Willpower. And it's a movement made up of charities, financial advisors, legal professionals across our entire country, working to show Canadians that we all have the power to make a difference through our wills. And this national marketing campaign is wonderful because it's it helps us with our messaging to our community, with our collateral to share. There's an amazing website that you can go on to and really do some personal calculations of impact. And it's just such a wonderful program. So your will is actually more than just a legal document. It's really a powerful tool to make change in the world. And part of the Willpower program is to make talking about our will and charitable giving and leaving a legacy just part of that social norm. We all need a will. We all are living. We all are going to pass. And what are we going to do with our assets when we go? I actually personally have a gift in my will, and many of my colleagues do as well. And you can support a cause that's close to your hearts. And we know that the more people that include charitable giving in their will to something that they're passionate about will make a huge difference to charities across our country. So one of our key messages is you can support your loved ones and your community. And, just making a 1% gift to a charity in your will leaves 99% of your assets to your family. And that's just comforting for you as parents and family members, but also for charities. It's just such a huge impact across our country. So we do have, this is the Willpower website, and it's got really great tools to kind of guide you through the process of leaving a charitable gift in your will. So if you can, if you're interested in including a charity in your will, it's always best to talk to your professionals like your accountant, financial advisor, or your lawyer. And also, if you have already included a charitable gift in your will, thank you. I'd like to just give you a little update on what we're working on with our community to raise funds and have an impact on the care here at a hospital. So just shift gears a little bit here. So one of our projects that we're doing is renal unit expansion. It's a $400,000 project that will see 3 additional stations added in our dialysis stations added in our renal unit. And also we know that the capacity of our renal unit is I think they're working at 100+% capacity right now. And we know that there's growth expected over the next 10 years of 24% of demand for this service. So we want to be ready to address that in a couple of different ways. Looking at adding an evening shift for dialysis, and also those 3 stations will be a permanent add in our renal unit. We've already raised over $300,000 for this project, and we're continuing to have some progress around this project. I'm sure you've all heard that our MRI has been upgraded. I'm very excited about this. So in the fall, it was actually stripped down to the magnet, and we were able to do an upgrade project rather than purchasing an entire brand new MRI. We were able to keep the magnet, which was a significant cost savings, a couple $1 million actually. So our new MRI, which is quieter, faster, safer, with more exquisite imaging, came at the cost of $1.7 million. And we've already raised 1.1 towards this project. And so we'll continue to work on this project as well with our community. When I talk about a safer MRI, and what I'm actually talking about is with our new MRI, the table where the patient is laying on it is actually detachable. So in most MRIs, it's actually affixed to the machine. And so if somebody goes into distress while they're in the MRI. They have to bring in a safe stretcher, move the patient onto the stretcher, take them out. So with our MRI, with the detachable table, it's just a much swifter addressing of that issue should a patient have go into distress while they're having their MRI. One of the great new projects we're working on that we've just started, and we're actually just starting to pull some information together and meet with our professionals and surgeons and managers and directors, is around minimally invasive surgical systems, surgical equipment. And so you may have heard of something called laparoscopic surgery, and that's what this equipment is used for. So rather than having an open incision, the surgeon actually makes little keyholes, and they use tools to go in, do the surgical intervention, and then you have a much quicker recovery time. It's less invasive surgery, and our current system's a bit older technology and does not support 4K imaging. So imagine trying to do some of the things that we do on our cell phones today on an old flip phone. It's kind of the same kind of analogy we like to use cell phones in our technological analogies. And so we want to make sure that we're able to have that the best possible imaging, because when you're inside somebody, you definitely want to be accurate, that's for sure. And so that project is $1 million or more. So we're just still working on some details around that. Thank you, Harriet, for bringing up our 50-50 earlier. So when you play, everyone wins, and we are over $40,000 right now for the prize pot. And we have our draw on January 31st. And that's the deadline for tickets at midnight on January 31st. We also have something called our annual hospital lottery. We've had this lottery for I want to say more than a decade. It's a $99 ticket. There's only 999 tickets available, and it's a bi-weekly draw throughout the year. You purchase your ticket once and you get to be in all the draws. Even if you win on any given draw day, your ticket goes right back in and you still have a chance to win on the next draw. And we actually have had people that have won twice on a Thursday. So lucky Thursdays for them. And so the draws actually start tomorrow, January 27th. And again, bi-weekly draws. You can purchase your ticket just by calling the foundation office. We don't have online purchasing available for the lottery as part of that licensing. But yes, that annual lottery does raise about $40,000 a year. And I'm available for any questions. Oh, thank you, Paul. That's fantastic. It's Bell Let's Talk Day, everybody.
I have a question.
Okay.
Okay. Going back, I think it was to your first slide, the one with the wills. If you give a donation in your will, so you give a large donation, is a tax receipt issued to your estate for that year?
Absolutely. So there is tax implications when you do give charitable gifts through your will. And so to measure what those implications are, it's always best to talk to your financial advisor. And one second here. Talk to your financial advisor, and they will advise you on what the impact would be, because everybody's net assets are different. And so depending on the size of your donation, it would have an impact.
And that would just go directly to the estate, I guess, right?
Yes. And so sometimes if you've left gifts to charities in your will, sometimes you're actually even, it will defer the tax that you're paying the government and leave more for your family, depending on how your assets are organized.
Okay.
Thanks, Debbie.
Yeah, thanks.
Harriet, you're on mute.
I have a question about willpower. If you 1% doesn't seem like a lot, to out of your assets. but I'm wondering, can you designate where you want that 1% to go?
Absolutely. I mean, we do advise that to leave some flexibility in that designation, just so that if you make your will, say when you're 50 and you pass away when you're 100, the healthcare system is much different after 50 years. So just depending on what that timing might look like, leaving some flexibility there. So it can be just in the wording of how you make your donation or your gift agreement, where I'm going to designate this donation to such and such. Should there no longer be a need for that, I would do a secondary designation or give the permission of the charity to put it to the most urgent healthcare needs.
Any questions for Tammy? Everyone knows where to go to get your tickets if you're interested. I really enjoy. I'm not much of a gambler. Like, I'm not a Las Vegas girl, that's for sure. But I really feel like I'm supporting, and that's important to me. You know, you're right. I think that's a win-win for sure.
It's the most fun trying to give away money, and it's meeting our winners and hearing their stories is just incredibly inspiring. February is going to be a pretty special month where we've got to draw for Valentine's Day, and we've also got 3 $1,000 draws. So we're calling it Fabulous, Fantastic February, and it's going to be a great time.
I got my monthly, I bought it last July. So I didn't even, kind of forgot about it until you mentioned it. I didn't know what draw day was. So I'm looking forward to Thursdays.
Wonderful. Thanks, Dorothy.
So Paul and Tammy, thank you so much. Our time's up. And I want to say to you, thanks for making us feel so welcome in your community. You know, your community, our community. We're all in this together. You know, that I know that's a kind of a cliche now, but we will do our best to support you as best we can. And we can do that by staying healthy, but we want you to stay healthy too. Stay healthy. We need you, Paul and Tammy, for sure.
Thank you all so much for even having us. So thanks so much.
All
It's
right.
always a highlight to come and see you all. Thank you.
Thank you, Tammy. Okay. Bye. Thanks so much.